You're dispatched to UK's campus for a 25-year-old male who has wrecked his bicycle into a tree. As you approach, the patient does not look at you.
Okay. This time I have on my standard precautions for body substance isolation. Is the scene safe?
Your scene is safe.
Okay. I note the mechanism of injury to be a bike wreck. Is this my only patient?
This is your only patient.
I'm going to call for additional ALS backup. At this time, I'm going to have my assistant take cervical spine immobilization. I'm going to verbalize my general impression, which appears to be a 25-year-old male lying supine on the ground who doesn't look at me when I walk up, and who appears to have the potential for significant injuries due to a bicycle wreck. I'm going to assess his level of consciousness. Sir, can you hear me?
Patient does not respond.
All right, I'll apply noxious stimuli.
Patient moans.
Okay. At this point, I find him to be responsive to painful stimuli. I'm going to look for his chief complaint, or do I see any apparent life threats?
You see no apparent life.
Okay, I'm going to have my assistant open his airway using a modified jaw thrust maneuver. What is his airway open?
You note sonorous respirations and gurgling.
Okay, I'm going to immediately suction his airway to remove the fluids from his airway, and the modified jaw thrust is maintaining his airway that is patent now.
His airway is patent.
All right, would he accept the nasopharyngeal airway?
You would accept a nasopharyngeal.
All right, I'm going to insert a nasopharyngeal airway. I'm going to now assess his breathing rate, rhythm, depth, quality, expose his chest, and assess for airway injuries. What do I find?
You find normal rate, normal depth, with an oral or nasopharyngeal way in place.
Okay, are the ventilations adequate to support life?
Ventilations are adequate to support life.
And do I see any airway injuries?
No airway injuries are noted.
All right, at this time I'm going to have 15 liters per minute non-rebreather mask administered to this patient. I'm going to move on to circulation. Do I see any life-threatening hemorrhage?
No life-threatening hemorrhage is noted.
I'm going to assess the pulse. What's its nature and quality?
Pulse is strong and rapid.
Okay. And his skin color, condition, and temperature?
He is pale, cool, and diaphoretic.
All right, I now note that these are signs and symptoms of shock. I'm going to treat the patient for shock. We're going to keep him warm. We're going to keep him supine. We're already administering 15 liters per minute non-rebreather mask oxygen, and we're going to rapidly transport him to the nearest appropriate medical facility. At this time, prior to rapid transport, we're going to perform a rapid head-to-toe trauma assessment. I'm going to start at the head. I'm assessing the scalp, in the back of the head, looking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, or swelling. Check his eyes, nose, mouth, looking in his ears as best I can. Move down to the cervical spine. I'm palpating it. I'm checking the trachea, that it is midline, and looking for jugular vein distension. At this time, I'm going to immediately apply a C-collar. I'm going to move down to the clavicles, the sternum, checking for equal rise and fall of the chest. And I'm going to also take in two locations. Are my breath sounds equal?
Breath sounds are equal.
Okay. At this point, I'll move down to the abdomen. I'm going to palpate all four quadrants. Do I notice anything?
Nothing noted.
Is pelvis, is it stable?
Pelvis is stable.
Genitalia?
Unremarkable.
I'm going to move down the legs, assessing for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, or swelling. Do I notice anything?
None noted.
In the left lower extremity, do I notice anything?
You notice that he possibly has a fib fracture in the lower extremity.
Okay. On the left leg?
On the left leg.
Okay. I'm going to assess the upper extremities. Do I notice anything looking for decap BTLS?
Nothing noted.
All right. This time we're going to roll the patient on your call.
1, 2, 3.
I'm going to assess the posterior, back, buttocks, legs. Do I notice anything?
Nothing noted.
All right. At this time, we're going to roll the patient back on your call.
1, 2, 3.
We're going to secure the patient to the line board with head blocks and spider straps. He is fully immobilized. At this time, I'm going to attempt to gather a sample history. Is there anyone here who knows him?
Nobody knows him.
Okay. Do I find any identification that would tell me his allergies, medications, past pertinent medical history, last oral intake, or the events leading up to it?
A bystander walks up and says they saw the accident happen.
Okay.
They advise that he was going through a crosswalk and there was a car quickly approaching, and they think he panicked and ran into a tree.
Okay. Thank you. At this time, I'm going to assess his baseline vital signs. I'm going to assess pulse and respirations.
Pulse is at a rate of 120. Respirations are at a rate of 20.
All right. have a blood pressure of 150/88. Is that correct?
You are correct.
Great. This time we're going to perform while we're en route to the hospital, we're going to perform a detailed secondary exam. I'm going to go back to the scalp. I'm looking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. I'm going to look in the ears as best I can see through the head blocks. I'm looking for cerebrospinal fluid and any blood. I'm going to look in the eyes. I'm going to assess for pupillary response, which I do have. I'm going to check the nose, the mouth. I see that I have a nasopharyngeal airway in the nose, and I'm going to assess the neck for jugular vein distension and tracheal deviation. I'm not able to palpate due to the C-spine. Do I notice anything?
Nothing noted.
All right, I'm moving down to the clavicles, the sternum. I'm going to check for equal rise and fall of the chest.
Equal.
I'm going to now also take in 4 to 6 locations. Do I have equal bilateral breath sounds?
You do. Equal bilateral breath sounds.
Okay. I'm going to assess all 4 quadrants of the abdomen. Do I notice anything?
Nothing noted.
No rigid, not rigid or distended.
Nothing.
Pelvis is still stable.
Correct.
Genitalia.
Genitalia is unremarkable.
All right. I'm assessing the right lower extremity, and I'm also going to assess for CSM, circulation, sensation, motor, but as he's responsive only to painful stimuli, I can just check for a pulse.
He does have fetal pulse.
Okay. As I move down here, I notice that I have a deformed, swollen left lower extremity. I would go ahead and have my assistant splint that.
Okay.
Do I have positive pulse?
You do have positive pulse.
All right. I'm now going to move up to the arm. I'm checking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, swelling. Do I have a pulse?
You do have a pulse.
Do I notice any of those injuries?
No injuries noted.
Same findings over here?
You are correct. No, nothing noted.
Okay. I can only check the posterior by reaching around, checking for blood, and I've already assessed the posterior of the patient prior to putting him on the long spine board. At this time, I'm going to continue with an ongoing assessment. Every 5 minutes, I will reassess any interventions that I have taken and make sure that I'm still treating him appropriately for shock, providing rapid transport. I'm going to assess his level of consciousness, his airway, breathing, circulation, and his vital signs every 5 minutes.